This is an incredible job and a great opportunity to help people. And one of the best parts is that we get to really help people when they need it.
Ultimately, my goal is to treat any of my patients as I want any of my family members to be treated. Just being able to watch them get back to playing with their grandkids, participate in the activities they like to participate in, being out and active, and just helping increase their quality of life, I really find is the most rewarding part.
Orthopedics is a very, very special field because you get into a patient's most desperate time of pain and mobility issues and either do a surgery or some non-operative care that can really, really make an impact to continue their movement and decrease their pain.
It takes a village to care for a patient from all of the various people, if you come see us, that you'll meet. And so every one of those people, we try to get people that are committed to making that the best experience that they can do.
Whether it be something simple or complex, I think the breadth of coverage that we're able to provide, I think is unique. All of these different facets that all intertwine are what make us unique and what allow us to take care of the community the way that I feel they should.
I see DMOS as the full-service orthopedic provider for anything that you would need, from bumps and bruises to major injuries and anything in between.
Each patient is an individual who has specific needs that need to be met throughout their care process.
Whether that be foot and ankle, hip and knee replacement, sports medicine, spine.
There are a lot of things we see patients for: early arthritis, partial tears, aches and pains, and they don't need an operation. And we want people to feel safe coming here, that you're going to get an opinion that is a 360-degree view of your problem.
We treat way more patients without surgery with conservative care, and the other things we have available, such as physical therapy or access through urgent injury clinics. And so you don't have to get an appointment for a couple weeks. If you need to be taken care of that day, you can.
We have multiple convenient locations here in town, in Ankeny, Urbandale, Des Moines, and then here in West Des Moines.
We often have patients that'll come to see us that have had issues for 2 weeks or 2 years. It's okay to start that relationship early. We're always there to come back when the time is right.
We're a small enough group that we can really spend the time with our patients and get to know them a little bit to help customize the treatment plan for them, give them what they need.
DMOS is giving people the value and the care that they need at the time that they need it.
At DMOS.
At DMOS,
At DMOS, we're here.
We're here
At DMOS Orthopedic Centers.
We are here when you need us.
We're here when you need us.
We're here when you need us.